Black and African Americans disproportionately, both in terms of the frequency in which they occur and in the severity in which they occur. Today, I'm so happy to have Dr. Toni DeMarcaida from Hartford Healthcare and one of her patients, Mr. Will Smith, to talk with us about those racial disparities, specifically with neurologic conditions and what Hartford Healthcare is doing to address them. A whole series of things that are being done to address them. Doctor, thank you so much, Mr. Smith. Thank you for joining us. I'll get to you in a second. I just want to start with you, Dr. DeMarcaida. Why don't you talk, before we're talking about what is being done about it, talk about those disproportions, please.
We used to think that neurologic conditions like multiple sclerosis, Alzheimer's disease, and Parkinson's disease were uncommon in Black and African Americans. Now what we recognize is that the numbers may have been underrepresented because Black and African Americans may not be coming for their medical care. In addition, we are finding that Black and African American patients are less likely to get medication for their conditions, less likely to get cutting-edge treatment for things like Parkinson's disease and other conditions.
And so that's why we have the Healthy Brain series for Black and African Americans. Talk to us, and this really is an outreach program. You guys are going right out into the communities.
That's right. We want to learn to communicate and resonate with the Black and African American community, to send the message that we are instruments for healing at Hartford Healthcare, and we want to be part of that community. The Healthy Brain series for Black and African Americans will provide education, outreach, and opportunity to talk with specialists in the neurologic field, and expedited access to our neurology clinics.
That is wonderful. Thank you for your patience, Mr. Smith. My understanding is you were diagnosed with Parkinson's disease, but you are benefiting greatly from deep brain stimulation. You want to tell us about that?
Yes, it's been a very positive experience for me. I would say that you should always try to improve your health, and that's definitely a way if you have neurological disorders to.
Do you want to sort of send a message out there to everybody who might be watching? Also, maybe sometimes this happens, especially just with men in general. We seem to be reticent to want to go seek out health care proactively.
Yes, sometimes the symptoms are very gradual, but if someone notices some of the problems that you have, don't dismiss it and try to be a tough guy and all that.
Yes. And that's, I think, Dr. DeMarcaida, what I love about this series is that you are not putting all of the onus on the potential patients themselves. You guys are going out. This is a whole series. First Church in Bloomfield, it's happening. Tell us about the next I guess, installment in the series, for lack of a better word.
We would love for patients who believe that they may have family members or themselves have neurologic symptoms to come to the First Cathedral in Bloomfield on November 3rd to hear Dr. Patrick Sanitis, who is himself one of only less than 4% of Black and African American neurosurgeons in the country who did Will surgery. And every first Thursday of the month, we will have another neurologic topic to talk about for Black and African Americans at the First Cathedral in Bloomfield.
And this one's going to be on, I believe, minimally invasive spine surgery, right?
The next one is on minimally invasive spine surgery for back and neck pain, brought together by Hartford Healthcare's Air Neuroscience Institute.
That is wonderful. So again, remember, November 3rd, happening right there at First Cathedral in Bloomfield. Doctor, thank you so much for joining us today. Mr. Smith, thank you so much for sharing your story with us, just to sort of put a face for the need and trying to overcome this inequity and these disparities.